And welcome to Sugar Talk with Dr. K. Jean Lucas, who is here with us here today. Good morning, Doctor.
Good morning.
And what are we talking about today?
Acromegaly.
Acromegaly. I had to ask you how to pronounce that because I was looking at it in your notes for me, and I thought, acromegaly? It sounds like an Irish toast. So what is acromegaly?
So acro means extremities, or the things at the end, and megaly means big. So it means that you have too much growth hormone and you're an adult. So if you're a child with too much growth hormone, you get to be really tall and big. And if you're an adult, you can't keep growing taller. So the only parts that grow are your hands and feet and face. And your organs, of course, can get bigger. And so that's what it ends up looking like your hands and feet get bigger. You have to wear bigger size shoes. And your face can get bigger, mostly the lower jaw and the forehead. The forehead sort of extends over the Neanderthal look. And then the jaw extends so that the teeth on the bottom separate and you have an underbite. And that's what happens over time. And it takes a long time for this to develop, as you might imagine. And some people aren't diagnosed for years and years afterward. But it can cause diabetes because increased growth hormone leads to high blood sugar. So that's what we're talking about. It's very rare. But it just has to be suspected when people look at people. Now, there's plenty of people that look like they're acromegalic, but they're not. So don't go around, diagnosing people. Might offend somebody. But anyway.
Well, and we've talked about this before. With the gestational diabetes, you can have a pretty large kid. I mean, my youngest son is now 6'8".
and they get, they're bigger at birth, and they stay bigger. They usually they're bigger, throughout. So, but it's normal for a child's hands and feet to grow, as they get older. But it's not normal for an adult's feet to grow. Sometimes during pregnancy they'll grow a little bit, like a half a size, but we're talking pretty long and wide. So the fingers are not only longer, but they're thicker. They're thicker fingers. So what they ask people is if their rings have not had to be cut off, or they couldn't wear their rings anymore. Not just because their hands are swollen, but their hands are bigger. They have soft tissue swelling as well. They also have excessive sweating for some reason. The growth hormone increases that. You can get carpal tunnel syndrome with it because it increases tissue growth. So carpal tunnel is when you have that nerve that goes into your fingers, the first 3 fingers, swollen around it, so that you get tingling in those fingers. A lot of people get that from the work they do or constant motion of their wrists.
But let's do the chicken and the egg argument here. Now, does this cause diabetes, or is diabetes causal to this?
No, it causes diabetes. Now, you can have diabetes before this. But usually if you're going to get this, one of the signs is diabetes, especially if you've had it for a long time. You don't necessarily gain weight, but you're insulin resistant. So you do make a lot of insulin, and you could tend to gain weight in the middle, just like people with diabetes. And you have high blood pressure because of the growth hormone effect. And you actually get an enlarged heart and heart failure. So it makes the muscles of the heart thicker, but they don't work better. They work worse if they're thicker.
But this is a very rare, you said this
very rare.
Is this Andre the Giant type of
Yes,
condition?
That's who had it. And also Ted Cassidy, who was in the original Addams Family, is Lurch. Lurch he must have had it when he was younger because he was very tall. But he had that facial, if you think about the face. And Andre the Giant ended up being about 500 pounds and very tall and died of heart failure. But
so there's obviously a lot of risks that go along with this to your health as time goes on.
Yeah, because Andre the Giant was 47 when he died. He didn't want his pituitary tumor operated on because he liked the way he looked.
Well, it was his career.
Because he was seen at Duke when I was over there. So
really?
It was very interesting. He didn't want anything done with it. But it is caused by a pituitary tumor. There's not really any other significant causes. It's hard to take enough growth hormone to cause acromegaly. I mean, the growth hormone is given, to help people grow and as replacement therapy for people that have had pituitary problems. But it's really hard to make everything grow. But the pituitary tumor makes tons of growth hormone, and if it's removed, then the problem goes away. Now, the bones that have already grown are not going to regress. So one way of finding this out is to look at people's driver's license over the years and see if they've changed or their picture changed. And some people just think
everybody's picture's changed, but that's one in
not
certain
mine.
ways.
Mine's
certain
exactly
ways.
That's exactly the same.
No, I'm not reviewing mine. All right, so but this is a rare condition.
It's a rare condition. I think everybody thinks about it. Well, not everybody, but we think about it. Endocrinologists think about it a lot, but we don't often find people with that. Women tend to have, their periods get disrupted. You can get headaches from the tumor because the pituitary is in the middle of the brain, middle of the head. So if you go through the nose and through the ears, that's where the pituitary is, and it dangles down from the brain. It's not really part of the brain itself, but it's controlled by the brain. So the tumor sits under where the optic nerves cross over in the middle of the head. So when you have a bigger pituitary, pituitary is in a bony casing in the skull, so it can grow up more than it grows out. And when it grows up, it presses on the optic nerve, so you get distorted peripheral vision first, but it can lead to blindness if the tumor gets big enough.
Okay.
So that's...
have you had a case other than studying Andre the Giant? I mean, have you ever had a case?
Yeah, and I had one that was picked up real early by actually the gynecologist because I'm not sure why she did that test, but she did there was a screening test for it, and she did it. It was very high, and the lady had no periods, and she was in her 30s, and they picked it up real early. And when we look back at her pictures, it was obvious that she had changed, and so she got that out. She did fine.
But it does happen over a significant period of time.
Yeah, and it's usually rare to pick it up early. Hers was picked up early because her period stopped for no reason. And she started having breast milk, which is another pituitary issue with prolactin. But sometimes the growth hormone is secreted with prolactin as well, so you have more symptoms of prolactin, which is the hormone that causes milk production.
Okay, we're talking about acromegaly. Again, it's a rare disorder, but we'll talk about how it's treated as well too, coming up in a moment here on a Coastal Daybreak and Sugar Talk with Dr. K. Gene Lucas. As always, you can go online and find out more about what's going on at beachdoctor.com, and we'll have more coming up in a moment. And welcome back to Sugar Talk with Dr. K. Gene Lucas, brought to you by Diabetes Endocrinology Consultants, and we're talking about a special rare disorder. What's it called again?
Acromegaly.
Acromegaly.
Just like it's spelled.
All right, and just like as well, that's right. All right, so now we've talked about the diagnosis. Again, there is a screening for this, right?
Yeah, there's a screening test. It's IGF-1, which is a protein that's pretty stable in the blood. You can't destroy the growth hormone because growth hormone is affected by a lot of things, but this is very stable in the blood, and it's a protein that is made by growth hormone, causing it to be made. And the treatment is you do an imaging study to look for the tumor, and then you just remove it. Now, some of them are really big, and some of them come back, and there's medications and injections that you can take to shrink the tumor as well. But the main treatment for it is surgery, and most of the time, the surgery does well if it's discovered early. So if you have
like this case where the one was caught really early.
Yeah, and that was actually really good for her. And a lot of them are caught pretty early, but some people, it's just that people look at them and think they have it. But just be careful who you say that to. Anyway, so
because I seem to remember reading about overuse or incorrect use of steroids or injectable human growth hormones can result in the forehead kind of appearance.
Yeah, I think it's really hard to take that much.
Yeah.
It's a very expensive medicine too, growth hormone, so you don't want to overuse it. And I'm not sure it helps that much with athletic performance. I don't know. People are using it, but
people have tried it, certainly.
They tried it. Now they just take arginine, and they think it's going to increase their growth hormone, but it doesn't.
So again, this is very treatable, especially if caught early. Then.
Yes.
Is there ongoing treatment after that?
No. If the tumor's removed, now if it comes back, they may have to go in again, or there's injectables that try to shrink it.
Do you have to take
they're not
something,
perfect.
Do you have to take something to replace the pituitary gland?
Or? Most of the time, if you can get the tumor out, the pituitary gland's there, but sometimes people have to get radiation because the tumor is not being able to remove surgically. It's not malignant, but it's just big by the time people find it out. And the radiation damages the pituitary over time. So over time, all the pituitary hormones gradually fail, and you have to keep monitoring those over time.
All right. So again, it's a very rare disorder, but if you suspect it, do you ask for the test or what?
Yes. Like if people have their hands and feet getting bigger.
As adults.
As adults.
Yeah. Not just kids, because that happens.
And not just because you have fallen arches that your feet get wider. So it's actually growth of your foot and your hands. And your hands don't go back. It's not like swollen hands. It's like they actually get thicker. The little pads and everything.
It's amazing how much we find related to diabetes in one way or another. And if you want to find out also about the next diabetes school coming up October 15th at the North Carolina Aquarium, you can find out more at beachdoctor.com or by calling 222-5700. That's 252-222-5700. Online at beachdoctor.com.